Every day our bodies send us signals. Sometimes they're clear, like when you feel pain after an injury, and other times they're subtle whispers that are easy to brush aside. Heart failure is one of those conditions that rarely appears out of nowhere. It builds slowly, and long before the heart struggles in a visible way, it leaves behind small, hidden warnings. The problem is that most people dismiss these signs as something ordinary: fatigue, stress, aging, maybe even a cold. And that's why today, we're going to talk about 10 hidden warning signs of heart failure that most people ignore every single day. This isn't about scaring you, it's about awareness, because recognizing these clues early can truly save a life, maybe even your own. Think for a moment about how you feel when you climb a set of stairs. You expect to be a little winded, especially if you're not used to exercise. But if you find yourself short of breath just walking across a room, lying in bed, or even talking, that's something different. Shortness of breath that comes suddenly or without a good reason is one of the earliest signs that your heart isn't pumping blood the way it should. When the heart struggles, fluid backs up into the lungs, making every breath feel like a challenge. People often blame asthma, allergies, or being out of shape, but sometimes the truth is deeper. If breathing suddenly feels like work, it might be your heart asking for help. Another signal is fatigue that doesn't make sense. Everyone feels tired after a long day, but imagine waking up in the morning already exhausted or needing to rest after doing something simple like carrying groceries. Fatigue connected to heart failure is different from normal tiredness. It happens because your muscles and tissues aren't receiving enough blood and oxygen, so they run out of energy quickly. Many people write it off as stress, poor sleep, or simply getting older, but this kind of persistent fatigue is often your body's way of saying the heart is struggling behind the scenes. Your legs, ankles, or feet can also tell you more than you realize. Swelling in these areas, known as edema, is another hidden sign of heart failure. It happens when the heart can't keep up with circulation and fluid begins to pool in the lower parts of the body. At first it might look like nothing serious, maybe just the result of sitting too long. But if you notice your shoes feel tighter every evening, or socks leave deeper marks on your skin than before, that's worth paying attention to. It's not just about discomfort, it's about fluid retention caused by a weakened pump inside your chest. Coughing that doesn't go away or wheezing in the chest is another warning people tend to ignore. We usually think coughs come from colds, infections, or smoking, but when heart failure is involved, the reason is fluid buildup in the lungs. Some people even notice pink or frothy mucus when coughing, which is a very concerning sign. If you find yourself struggling with a cough that doesn't improve or keeps you awake at night, it's important not to dismiss it as just seasonal allergies. It could be your heart revealing the truth in a way you never expected. Now let's talk about weight. Most people celebrate when they see the scale move down and worrying when it goes up. But in heart failure, sudden weight gain like 2 or 3 kilos within a few days isn't about food. It's about fluid retention. The body holds onto water and the heart can't pump properly, and that water shows up as extra weight. You might think it's bloating, diet, or lack of exercise, but if your weight jumps quickly without explanation, it's your body waving a red flag that should never be ignored. Loss of appetite or feeling nauseated may not seem like something connected to the heart at all, yet it often is. When the heart isn't working well, blood flow to the digestive system decreases. This makes eating feel uncomfortable, food less appealing, and sometimes leads to nausea or a feeling of fullness after only a few bites. People may assume they're dealing with stomach issues, but it's really the heart indirectly affecting digestion. If you find yourself pushing away meals without reason, that could be a quiet clue of something bigger happening inside. The brain also feels the effects of poor circulation. Confusion, memory problems, or difficulty concentrating can all appear when the brain doesn't receive enough oxygen-rich blood. Imagine trying to focus on reading or having a conversation and suddenly losing your train of thought more often than before. Many people laugh it off as senior moments or being distracted, but when this becomes frequent and unexplained, it might be linked to the heart. Your brain relies on steady blood flow, and when the heart struggles, the mind follows. Another clue comes from the rhythm of your heartbeat. A heart that isn't functioning properly often tries to compensate by beating faster. People might notice palpitations, fluttering, or racing heartbeat even when they're resting. While anxiety and caffeine can cause similar feelings, a persistent or unexplained racing heart should raise concern. It's the body's way of trying to keep up with demand, but it's also a sign that the system is under pressure. Changes in skin temperature or color also carry meaning. Cold hands and feet, or skin that turns pale or bluish, especially around the lips and fingertips, indicate that circulation is poor. The heart isn't delivering enough oxygenated blood to the extremities, and the body is showing it outwardly. These changes may look minor, but they are visible warnings of what's happening deep inside. Finally, there's trouble with sleep. People with early heart failure often wake up in the middle of the night gasping for air, or they find they can only sleep comfortably when propped up with several pillows. That's because lying flat allows fluid to shift into the lungs, making it harder to breathe. Restless nights, constant awakenings, or needing to sit upright to catch your breath are not normal. They're signs the heart is struggling more at night when the body should be resting and recovering. So why do most people ignore these signs? Because each one, by itself, can seem ordinary. Who hasn't felt tired, had a cough, or dealt with swollen feet after a long day? The danger comes when these signals appear often, get worse over time, or show up together. That's when it's no longer coincidence, that's when the body is shouting, not whispering. If you or someone you love notices these hidden symptoms, shortness of breath, unexplained fatigue, swelling, cough, sudden weight gain, loss of appetite, confusion, palpitations, cold extremities, or sleep problems, it's important to take them seriously. Early detection can change everything. Doctors can run simple tests, offer treatments, and help prevent the progression of heart failure. Waiting until the signs are too strong often means the condition has already advanced, and treatment becomes much harder. The truth is, the heart rarely fails without warning. It tries again and again to communicate through these small signals, hoping someone will listen. The challenge is that life is busy, and people often push through discomfort, convincing themselves it's nothing. But health is one area where ignoring the signs can be devastating. Listening to your body, paying attention to changes, and seeking help when things don't feel right is not weakness, it's wisdom. So next time you feel unusually breathless, notice swelling in your legs, or wake up tired despite a full night of sleep, don't brush it off. Think about what your body is telling you. Share these signs with your family, because sometimes others notice changes before we do. And remember, knowledge doesn't just protect you, it protects everyone you care about. Now let me ask you a question. Have you ever experienced any of these hidden signs yourself, or noticed them in someone close to you but didn't realize it could be linked to the heart? Share your thoughts in the comments below, because your story might just help someone else recognize the truth in time.